Good afternoon to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote doctor for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Jayanti Thumsi. Welcome to our platform, ma'am.
Thank you. Thank you very much.
Is an MBBS MS General Surgery lead surgeon at the Department of Breast Oncology at Apollo Hospital, Bangalore. With the help of ma'am and her wonderful insight, we will be taking a close look on today's topic, which is breast reconstruction and oncologist surgery. Now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Thank you very much and welcome all of you. Thank you for this opportunity and let's make this an interactive session. And please feel free to ask any questions that come to your mind. The topic I thought I will speak on, being a surgical oncologist, is that breast reconstruction and oncoplastic surgeries. We all know that the incidence of breast cancer is on rise all over the world globally. It is on rise, and it is one of the concerns, a big concern for any government or any health provider as to how to deal with this. And there are so many aspects that we need to think about when we plan a treatment for the patient. Yes, surgical treatment is one of the mainstay treatment as far as breast cancer is concerned, and there have been immense advances in surgical practice in breast oncology. Can I please have my slides, please? Are the slides seen? Okay, so the topic that I will be
Yes,
speaking
ma'am, it
on
is visible.
is okay, breast reconstructive surgeries in early breast cancer. So, breast cancer is the commonest cancer occurring in Indian women and also globally, and it accounts to about 39.4% of cancers occurring in a woman. Yes, the incidence of this disease is on rise, and it is estimated that 1 in 29 women in India is at risk of developing this disease in their lifetime. And according to the Western statistics, 1 in 8 women is at risk of developing this disease. But unfortunately, in countries like India or in developing countries, about 48% of patients who develop breast cancer are less than 50 years of age. Yes, lot of premenstrual women who are in the premenstrual age group develop this disease. About 4% of them are just 20 to 30 years. 6% of the women who develop breast cancer are in their 30s or 40s, and about 28% of them are in their 40s and in early 50s. Yes, we have a lot of young population in India who develop this disease as compared to what we see in the West. In the West or in developing countries, it is more a post-menopausal disease. However, in developing countries like ours, it is basically a premenopausal disease. The behavior also of the disease also is extremely different, as you can understand that a lot of younger women develop the disease, and the disease tends to be more aggressive in our country as compared to any other developing countries. In spite of all of this, breast cancer has one of the highest 5-year survival rate of 81.89%. Yes, the incidence is on rise, yet so much advancement has happened that it has one of the highest 5-year survival rate as compared to any other cancer. Innovative research, improved technology, better diagnosis, newer medications has helped cure more and more breast cancer patients. And 81.89%, which is the 5-year survival rate, includes women of all stages of breast cancer. So, when we need to remember that breast cancer is not only a scientific topic, but it is also a social issue because it raises concern not only of survival but also about femininity, body image, fertility, and sexuality. So, when we plan the treatment, we need to consider all these topics in mind when we actually plan the treatment. So, with improved survival rates, focus should be not only on curing cancer but also offering good quality of life. Yes, breast cancer treatment, a lot of it has already been standardized, but we need to consider that there are a lot of women who are younger when they develop this disease. We need to also consider the other issues or other aspects of life when we plan the treatment so that we can offer not only cancer clearance to the patient but also offer good quality of life. Now, the treatment options for breast cancer are divided into loco-regional therapy and systemic therapy. Now, loco-regional therapy includes surgery and radiation therapy, and systemic therapy includes chemotherapy, hormone therapy, immunotherapy, targeted therapy, and many more therapies, which and this list can go on and on. However, surgery is one of the most important modalities of treating breast cancer as of now, which is a loco-regional treatment. Yes, in the past, mastectomy was the commonest surgery practiced. Halsted was a great surgeon in that era who practiced radical mastectomies, wherein not only was breast removed, but also the chest wall muscles and the axillary lymph nodes were excised. Because it was thought at that time that breast cancer was a local disease. That means it spreads in contiguity. It was thought that the tumor starts in the breast, then in continuity it spreads to the axillary lymph nodes or the pectoral muscles, then it goes to the supraclavicular lymph nodes and then to the rest of the body in that fashion. But soon Halsted realized that for more than 100 years, radical mastectomy was the standard surgery done. But soon surgeons realized that in spite of doing mastectomies, there are a lot of women who actually came with a relapse. And hence they started doing further radical surgeries, which included removal of the internal mammary glands and the supraclavicular glands. So, in short, all of these radical and radical surgeries left a woman with a very bad emotional outcome. They had a very scarred chest wall, and the surgery itself was very dreadful, and women chose better to die of the disease than undergo such radical mutilating surgeries. And then there were a lot of advancement which happened. It was realized that breast cancer was not only a local disease, but it is a potential systemic disease. What happens locally is a presentation and representation of a systemic disease. And this understanding of this has caused a paradigm shift in the surgical management of breast cancer. Hence, mastectomies have been now replaced by what we call as breast conservation surgery, and umpteen number of studies have proven that mastectomy has no better advantage over breast conservation surgery. Breast conservation surgery includes removal of the breast with a rim of normal tissue and addressing the axillary nodes by either doing an axillary lymph node dissection or clearance or doing a sentinel lymph node biopsy. Breast conservation surgery is safe and now is the standard of care for women with breast cancer all over the world. In fact, there have been many studies which have shown that mastectomy has a negative impact on a woman. Female breast is a potent symbol of beauty, motherhood, and vitality. Body image of a woman includes the symbolic meaning and importance of her breast. Mastectomy as a treatment option means losing a part of the body, and this can result in a sense of mutilation. It causes diminished self worth and may threaten perceptions of femininity. The more a woman values her breasts, more devastating effects of having a mastectomy can be. Studies have shown that mastectomy has a deep rooted negative impact on a woman and can severely affect their body esteem. It also causes psychological reactions such as depression, anxiety, stress, and affects interpersonal relationships. Hence, cancer clearance with good cosmetic outcome should be the focus. Issues of femininity need to be considered while planning the type of surgery. Breast conservation surgery is preferable if oncologically feasible, but in some cases, if mastectomy is inevitable, skin sparing or nipple areola sparing mastectomy with primary reconstruction should be done if oncologically feasible, and that is what we are going to talk about today. So, oncoplastic and breast reconstructive surgeries. Oncoplastic surgery is an approach for breast cancer patients that aims at improving cosmetic outcomes. By using these advanced surgical techniques, it not only helps us in clearing cancer, but also prevents undue distortion of the breast. It maintains aesthetically pleasing breast after all of the treatment of cancer is complete. It also permits wider excision of the tumor with a superior mean volume of specimen and potentially reducing the incidence of margin involvement. The techniques involved are related to volume displacement or replacement procedures. Now, as you can see pictures here, these are some of the surgical pictures in our department. The first one you can see is a 37-year-old lady who came to us with a breast lump, and we have done a breast conservation surgery. This is the scar which is seen here, and there is one scar seen here to do the axillary lymph node clearance. This is a picture which is taken about 2 years after surgery, after completion of surgery, chemotherapy, and radiation therapy, and you can see that the scar is very, very pleasing. Yes, this is what has replaced the radical surgeries or supra-radical surgeries, that is mastectomies. This is another patient who has a scar. You can see here a very, very light scar in a 34-year-old lady. And this patient was again a very young patient who came with a lump in the left-sided breast. You can see the left-sided breast is much bigger because there was a tumor here. And post-surgery, there is a scar you can see lower down, which is hardly seen. And the ptosis has been corrected, and you can see the appearance post-surgery. This was another patient who came from West Bengal to us with a large mass in her left breast. You can see this is a MRI film. There was a huge mass in the left breast. And then we have done a surgery here where you can see the scar is inferior and it can hardly be seen. In this patient, again, very young patient, there was a large tumor in the left side. And in fact, it was thought that when her mother brought her that she had some developmental anomaly. But we realized that there was a lump, a huge lump was seen. and we have done the corrective surgery. As you can see, cosmetically, it is quite an acceptable scar. Scarless oncoplastic breast conservation surgery is what can be done, wherein we put a scar all around the areola and the nipple, and you can see the finally the scar immediate post operative. You can see this is where the axillary clearance is done, and this is the scar around the nipple areola. You can see there is a drain which has been kept in this case. This is called as a round block technique. You can see a round block of tissue is removed like a donut. A part of the skin is de-epithelialized, and through this method we can approach a breast lump in any quadrant of the breast. And you can see finally immediate post operatively, this is how the scar looks like. Now, this patient is after finishing her surgery, chemotherapy, and radiation therapy. You can see the scar here. This is what we had done, a round block technique of oncoplastic surgery. And this is what I said is almost like a scarless surgery in this patient. This patient also had a right-sided breast cancer, which was in the upper outer quadrant. You can see here we have done a round block surgery where the scar is hardly seen. And these scarless surgeries or oncoplastic surgeries are extremely essential to keep the emotional quotient of the patient high. It improves their self-esteem as compared to doing a mastectomy and removing their entire breast. This is another kind of oncoplastic surgery which is called as a bat wing surgery. It is very good for tumors which are in the lower quadrant or also in the upper quadrant, and mainly when a part of the skin is involved. The skin may be tethered, and we might have to remove a part of the skin. In those cases, this kind of bat wing surgery is very, very useful. You can see this is the marking which has been done. This is the skin and the areola, and here are the two wings. And one more incision is kept here. This entire skin here is de-epithelialized, or it comes out along with the tumor. You can see here the tumor and the skin is stuck over here. This much part is removed, and we can do what is called as bat wings procedure, and the skin is closed with minimal scarring. This is another patient who had a lump in the upper quadrant, and you can see bat wings oncoplastic surgery has been done, and the scar is very, very minimal. And this was another patient. It was an international patient who came to us from Middle East, and you can see she had a large, I think this patient was from Yemen, a large lump in the right side of the breast, and which also had gortosis because of the large size. Here we have done a bat wings procedure, and this is the scar which was given ultimately after healing. Local advancement flaps are another way of treating these kind of patients. With a breast conservation surgery, a tumor and a small portion of surrounding tissue is removed. However, depending on the size and location of the tumor, this can still deform the breast. In such cases, a local advancement flap is used to reconstruct the original appearance of the breast. This helps in replacing the loss of volume and leaves no additional indentations or defects. You can see here, these are patients who came with very large tumors. If there are very large tumors and we remove a rim of normal tissue around it, the volume loss is huge and the volume needs to be replaced. And in these two cases, we have done a LD flap, that is a latissimus dorsi flap. From the back, the muscle is dissected, and here it is used to fill the volume loss which is there. And you can see in this case, the skin also from the back was used, and LD flap reconstruction has been done. In this case, this patient had a tumor which was it was in the central quadrant, very close to the nipple and the areola, and hence the nipple areola had to be excised. And normally, otherwise, we would have done a mastectomy, but using the skin and the muscle from the back, that is from the latissimus dorsi, we could reconstruct. And if she so wishes, later on, we could also create a nipple and the areola by tattooing. This was another patient who came from, I don't remember where, but this was again a central quadrant tumor. And you can see here the latissimus dorsi flap has been placed and a reconstruction has been done. And it is a very useful kind of a flap, especially for the central quadrant, because in central quadrant, if you excise only the lump, it causes indentation and there is kind of a dip within the central quadrant, and that can be avoided by using the latissimus dorsi flap. In fact, latissimus dorsi is very, very useful in doing these reconstruction surgeries. It is just a rotational flap. It is not a free flap and no microvascular surgery required. You just need to rotate the muscle from back to the front region, and it can be used for any quadrant in the breast. In this patient, you can see they had come with a large tumor, and we have almost done a quadrantectomy. A quadrant of the breast has been removed, and such large tumors can now be removed because of the flap reconstructive surgeries. So this was another patient who came with a bilateral breast cancer. She had bilateral lumps in the central quadrant, and here we have done a LD flap reconstruction. You can see this is the scar in the back where the latissimus dorsi muscle has been dissected, and a flap has been rotated, and the breast has been reconstructed in this fashion. In some cases where there is a large volume loss, yes, we need to use an implant. An implant needs to be covered either with ADM, that is acellular dermal matrix, or by using certain tissue. In this case, again, LD flap is extremely useful. In this patient, you can see we have done a skin sparing and a nipple sparing mastectomy. We have put an implant in this patient in the left side. This was about a month after the surgery, and slowly the edema, as you can see in the left side, also reduces, and now it is almost symmetrical looking breast in this patient. She was also a very young patient who had a left-sided breast tumor. Again, these two patients, bilateral disease in this 38-year-old lady, central quadrant, where we have removed the nipple and the areola, but we have not used the skin from the latissimus dorsi, only the muscle has been used, and a scar has been given to her, but the mount is created of the breast. This patient had a large tumor where again a flap reconstruction has been done in this 43-year-old lady. These are the pictures of tram flap post mastectomy. That is rectus abdominis myocutaneous flap is raised from the abdomen. You can see here this patient had extensive DCIS, ductal carcinoma in situ, high grade, and hence she had to undergo mastectomy. We have done the mastectomy along with removal of the nipple and the areola, and you can see that a tram flap reconstruction has been done in this 52-year-old lady. This patient again we had to do a bilateral tram flap reconstruction post bilateral mastectomy. You can see the skin has been used, and Both the breasts have been reconstructed, and this is the scar of the tram flap and from the abdomen, and you can see that the nipple is left intact. This was another patient with the tram flap reconstruction on the right side. This is 6 months later, breast reconstruction done post mastectomy on the right side. You can see this, and this is the scar which is seen in the abdomen. So, just to, in short, we have moved away from a surgical philosophy that once aimed to remove as much as possible, to remove as much as needed and as little as possible. Yes, there has been a great paradigm shift as far as surgical practice of breast cancer is involved. We have come a long way. No more radical surgeries are needed. Mastectomy is also not does not have advantage over breast conservation surgery. Breast conservation surgery is possible if it is a unicentric disease, whatever is the size of the lump and whichever quadrant the lump belongs to. Breast conservation surgery is possible either by doing conservation surgery, that is lumpectomy, or if the tumor is large, we can do oncoplastic surgeries or even flap surgeries. And a pleasing cosmetic outcome can be given and not compromising oncological safety in these patients. So, oncoplastic breast surgery and reconstruction surgeries combines the techniques of traditional breast cancer surgery with the cosmetic advantages of plastic surgery. The goal is to remove cancer while minimizing the unwanted effects of surgery, helping patients heal both physically and emotionally, which is very important. Like I said in my earlier slides, not only is oncological clearance important, but giving a good quality of life is extremely important, especially in women who are younger in age when they develop breast cancer. Yes, young women developing breast cancer is not as uncommon as we think. In fact, in countries like India, 48% of women are very young. We see a lot of women who are not even married. In fact, yesterday we have done a surgery on a 27-year-old girl who had a multicentric breast cancer. Her mother was our patient as well. And yesterday we have done a mastectomy, skin sparing and nipple sparing mastectomy, and followed by a tram flap reconstruction in these patients. So yes, this slide is what I like to use many times, and this is why is a specialized breast unit important, because there have been studies which have shown that when a patient is treated in a specialized breast unit as against a general surgery unit, they are known to improve survival. Breast surgeries done by surgeons not trained in breast cancer, 45% tend to be incomplete, 80.3% of them have residual nodes, and 52% of them were already metastatic. So, thank you very much. It was a pleasure speaking to all of you, and I will be very happy to take questions.
Thank you so much, ma'am, for your wonderful presentation. So we do have some questions from our audience. So the first
Yes.
question, ma'am, sorry, could you elaborate on the latest advancement of oncoplastic surgery techniques that allow for prevention of breast tissue during tumor excision while ensuring optimal oncologic outcome?
Yeah, I think that's a very important topic, and yes, our mindset has to be towards that. Breast oncoplasty, the easiest oncoplastic surgery is the donut surgery or a round block technique, which I just showed some of the pictures. even if somebody not trained in oncoplastic surgeries, it is very easy to do a round block technique, and through that you can reach any quadrant of the breast. That is the easiest to do. There are many levels of oncoplastic surgeries, but the easiest one is the round block surgery or the bat wing surgery, which I showed.
Thank you so much, ma'am. The next question from our audience is: what is the role of patient reported outcomes in evaluating the success of reconstruction and oncoplastic surgery procedures, and how can these outcomes be optimized for the patient satisfaction as well-being?
Yes. So, one thing we need to remember that we always need to counsel the patient that uh, the symmetry of both the breast, um, can be uh, can be assured only if corrective surgery is done also on the opposite breast. Now, we do say a implant surgery or a tram flap surgery, but it may actually not perfectly match the opposite breast, which is unaffected. And if the patient needs is very interested in symmetry, a reduction mammoplasty or augmentation of the breast of the opposite side needs to be done. But in my experience in India, to the opposite side, such another surgery to the unaffected side is not welcomed in women in our country. But yes, I'm sure that will be the way forward. So right now we certainly try to match the torsos, we try to match the opposite breast as much as possible, but the patient should be aware that she cannot expect symmetry unless the opposite side torsos is also corrected. So, a clear communication with the patient is very important. The patient should be, as much as possible, be aware as to what she can expect after the breast cancer surgery, especially the oncoplastic and reconstructive surgeries. And for this, being in communication with the patient, explaining to them is very vital.
Thank you so much, ma'am. The next question from our audience is: what are the challenges and opportunities in coordinating a multidisciplinary approach to breast cancer treatment in oncoplastic surgery?
So yes, the multidisciplinary treatment is certainly what is practiced and what needs to be practiced. But usually, a multidisciplinary treatment is practiced to plan the overall treatment of the patient. Now, what is the kind of surgery that a surgeon does? It cannot be defined by a medical oncologist or a radiation oncologist who is part of a multidisciplinary team. But yes, a plastic surgeon and an oncological surgeon, surgical oncologist and a plastic surgeon together need to plan the exact treatment, the incision, and the patient's desires, of course, keeping oncological safety in mind. And yes, a team approach to this is extremely important.
Thank you so much, ma'am. The last question for our audience is: can you discuss the potential impact of reconstruction and oncoplastic surgery on long term cancer survivor, including quality of life and body image?
Yeah, in fact, the oncoplastic surgeries and reconstruction surgeries are done to improve the body image so that the perception of the woman about herself is kept intact, and that is what I have been emphasizing throughout, where a good quality of life is very important. The discomfort that we often see in patients, whether it is short term or in long term, are mainly because of axillary clearance. In some patients, if the axillary lymph node burden is high, we land up doing axillary clearance even after neoadjuvant chemotherapy. And the discomfort which comes is mainly because of axillary clearance. The local oncoplastic surgeries or even the flap surgeries are not discomforting at all in the long run. In in fact, the feel of the breast is also intact. But of course, if a mastectomy is done and a implant is placed, the tactile sensation will be altered, but to look at it will be very pleasing. That's what I can say. Yes, that is the flip side of it, that the tactile function is lost, but it certainly helps in keeping the body image of the woman intact.
Thank you so much, ma'am. That's all from our audience. So before concluding today's session, ma'am, any last remarks from your end?
So I would recommend all the doctors who are viewing this, and if you are a surgeon, and if you are aspiring to do breast surgeries, breast reconstruction surgeries, oncoplastic surgeries should be kept in mind, and that is the only way ahead. When we were students, it was said that big surgeons put big incisions. And no more is it like that. Big surgeons put smaller incisions and better scars and better outcomes of so even cosmetic outcome after breast cancer surgery. So all the surgeons, aspiring breast surgeons, getting trained in oncoplastic and breast reconstructive surgeries is extremely important.
Thank you so much, ma'am. With your permission, I would like to conclude today's session. Thank you so much.